I know that we've run a couple of minutes over time, but what we have coming up next is also extremely important. Mental health doctor's perspective. Dr. Ashwin Naik will speak about the renewed focus on mental well-being in a pandemic-hit world. He will specifically dwell on how organizations and employees can address these issues. Dr. Ashwin Naik is a healthcare entrepreneur and founder of Mana Wellness. So Dr. Ashwin Naik, if we can hand you the stage and the screen and the mic, you can take over and run. Thank you so much for joining us here today.
Thank you, Shreya. Can you hear me okay? Great. Thanks,
yes,
everyone. I really enjoyed the panel. Hi, Mukti. How are you? Mukti is a co-Ashoka Fellow. Very interesting to hear all these comments and thoughts. I think running over time was useful because most of what I was going to say is already covered. But let me start with a question. Imagine that you walk into your office on a Monday morning and get an email from someone in your team marked to the all company list, which says, "Hello, everyone, I'm taking off today for mental health reasons. Thank you." What would be your reaction as a manager to this person? This is exactly what happened with a company called Olark. The boss, the founder of the company, Ben, got an email from one of his colleagues, Madeline. And some of you might remember this email actually went viral. And it went viral because of the response of the CEO. Right? And the CEO's response was, "Thank you for your email and reminding me again that we can all take day off for mental health issues. I wonder why this is not a common thing at all organizations." And this email just sparked a big conversation. I think this was about 4 or 5 years ago. And thousands of people on the internet responded to this email with their own experiences with mental health, how it affects them at the workplace and things like that. So my question to you is, how many of you want to be Ben, the manager or the boss? How many of you want to have Ben as your manager or as your leader in the organization? The leader who recognizes the need for mental health as important as physical health, as many of you have mentioned. So that's, I think, the starting point. The second piece that most of you have spoken about in the previous panel as well is the impact of COVID. Now, COVID is a significant wake-up alarm for all of us, and not just for us in India, but for health systems across the world. And specifically for mental health, this is a significant one. And my worry is that we will hit the snooze button again and go back to sleep, because this is not the beginning of the mental health pandemic. We have been dealing with mental health issues for many, many years, many decades. And I think governments, organizations, and as individuals, we have not done what we were supposed to do. So I think this is the perfect time to wake up and get to work. But before we do that, let me ask you to imagine a world where mental health is treated with the same importance as physical health. A world there is no stigma, no discrimination, no shame, or no lack of access to good mental health care. What would this world look like? Take a moment, think about it. I'll wait. I bet most of you have imagined happy, smiling people in almost a hippie-like state, in fancy colors, doing yoga or running around in a park. Or you must have imagined a bunch of people together, smiling, talking. Some of you must have imagined people to be outdoors or things like that. How many of you imagine people sitting in an office? Right? Let's think about it. Our notion of good mental health is happiness, joy, celebration, carefree, outdoors. But I think that's an important point to start for us, which means that good health, good mental health doesn't have to be this hippie state of happiness and joy. It also is meaning, purpose, understanding, and compassion for each other. So I think we have to start with defining what it means to be in good mental health. On the other hand, if you imagine a state of poor mental health, I think Shubha mentioned this, is we think of it in extremes. We think of unrest, we think of suicide, we think of violence, we think of terror, fear, etc. But we don't realize that poor mental health is also distraction, poor concentration, anger, poor relationships, lack of coping skills, and things like that. So my first submission to you is that the first step towards changing the narrative is to first recognize how poorly mental health is understood and diagnosed and treated, and the language we use and the images that we create in our minds, movies, conversations are all very, very important. So let me start with the basics and share some thoughts about what we can do about this. We all have mental health challenges. I think the reports show that 1 in 7 in India have an undiagnosed clinical mental health issue. But all of us in this meeting and elsewhere also suffer from poor mental health in our lives. And that's a given. We can't escape that. This is even more important for the younger generation. I think the generation which is now entering the workforce, people who are coming to their first job at the time of this pandemic or afterwards, I think it's a significant impact on their well-being. As a matter of fact, mental health and other issues are number one cause of death for younger people, particularly suicide, death by suicide for younger people in the age group of 15 to 29 years. So given this dire situation, how do we make sure that we don't go back to that snooze button again? So my suggestion, and this is a campaign we ran last month, the campaign is called Baat Karenge to Baat Banenge. And I think many of you spoke about this earlier, is that we have to start these conversations. And I suggest that we do it at 4 levels. Level 1, let's start by holding our organizations accountable. Do we have the mental health support at work? Can I confidently take a day off for mental health? Is there somebody at work I can trust and talk to? Data has shown that presenteeism costs 1.8 times more than absenteeism. Presenteeism when you show up to work physically, but there's nothing much. I mean, this is even more acute in COVID situation because I'm not even there physically. So I think there are, one of the advantages is that there are examples already that organizations can adopt. And one example that I like very much is the ICU program by DuPont. And ICU, while it stands for Intensive Care Unit, but in this context, it stands for Identify, Connect, and Understand. I think it's as simple as that, finding the way to identify issues, connecting with the people, and then understanding them. But the key point here is not to diagnose, right? I don't think we are professionals at work that we can diagnose. And the worst thing is to look for a cause, to say, this is why it is happening. I think the only thing that we need is to train people how to speak about mental health and how to listen. And active listening is a big part of it. And like one of the earlier colleagues on the panel mentioned, this is not an HR function. This is not an engagement function. This is an organizational strategy issue. And it has to start from the very top. I think unless CEOs or MDs of the organizations start with holding an open house, talking about mental health and the opportunities for the people in the organization to come out and share their concerns and find the right support, I think we will move very little. One of the things that we are running next month for the World Mental Health Day is a Move for Mental Health pledge, where we are asking organizations to publicly come and pledge their support for mental health for their employees, for their community, for themselves. So that's another place that some of you can come in and sign up. The second piece I would submit is to hold your teams accountable. right? I think all of us have been in situations where we have a star performer who's suddenly late, absent, or behind work. You let it go once, you let it go twice, but then you really double down and focus on the project and timelines and how it is important to get things done. But very rarely do we have the chat about what is going on behind the scenes with that person. It's always about the performance and not the person. So I think the significant role of a manager is to have this conversation. And one thing that we have realized in our work is that managers are very uncomfortable talking about mental health. And it is partly because of not having been trained to speak about mental health at work. How do you even start a conversation? It feels awkward, like Subha and others said. How do you start the conversation without making it very awkward for them and for the other person? So one of the things that I really like how organizations are tackling this is making it part of the system, making it part of your day-to-day process. For example, starting your Monday morning meetings with a mental health check-in, just to make sure everybody is okay. And let's not wait till people come out and say, I have a problem. Can we not do this proactively? So there are some of the things I think we'll have to start training our managers to have these conversations. The next piece I would talk about, and this is, I think, the most important takeaway from this part, I would say, and I hope that this is what you take away from this talk, is given that the young people are at much higher risk than any of us at this stage, how many of us are having these conversations at home? If you want to do one thing, I'll start from there. I think today at dinner, when you sit down with your family, just ask them how they are feeling, or is anything bothering them? And at the same time, don't be like me, because every time I ask my daughter this question, her response is this question going to follow a lecture? So let's not lecture, just listen to them. Don't advise, don't judge, don't give an explanation. Just listen to them and say what is going on. Because really, I think data is showing people are getting extremely uncomfortable in the pandemic, but also in general during the changing circumstances. Finally, holding ourselves accountable. I think it's unfortunate that we get caught on with life and work and really miss the opportunity to talk to yourself, meaning really spending time to talk to yourself, whether you write a letter to yourself or email or whatever is comfortable, but making the space to hold yourself accountable. Do you have the trusted circle to share what you're feeling? Do you have a self-care kit, which of course doesn't involve online shopping and eating desserts? These are some of the things that we should have as part of our self-care kits. Now, going back to the story I started with, the story of Madeline and her boss, Ben, the internet went wild with how sensitive Ben was about mental health at workplace and how we need more Bens as leaders and managers. But to me, the real story of that hero is Madeline. She said what many of us wouldn't have dared to say, much less write on an email to all staff mailing list. She took the first step to prioritize herself and communicate to the team without fear of stigma or any apprehension. She dared to say, this is important, mental health is important. So my parting message to all of you is, be like Madeline. Thank you very much.
I think you brought into the conversation a lot of aspects of what organizations can do in light of the times that we're going through. I'm going to request our audience to actually post questions on the Q&A section. Can we have you all post your questions so that we can have Dr. answer them? I myself have a question, and this in context of awareness, right? Because a lot of times language makes a huge difference. How you speak to somebody and what you say to them. It's great to say, I'm available to talk to, pick up the phone to me, but then what do you say after the first question? And if somebody says, I'm not okay, then what should you be saying to this person?
Right. So my suggestion, Shreya, is first of all, whoever is in this position of authority or position where people come to you, I think there needs to be a basic level of sensitization on how to deal with this. That could be through, awareness sessions. It could be a formal mental health first aid training. It has to be a structured process. Many a times what happens is, I am a good listener is not the answer, right? I'm a good listener will work to a certain extent, but you also need to know when you have to stop listening and escalate it to the right professional. So I think being aware of what I can do, I have to be there for my colleague, but what are my limitations? I worry about that a lot. So having that structured training for your teams will be very, very critical in this context.
Right. I think that's important because a lot of times, people say, I'm here, I'm willing to listen, but then they don't know what next to say because a lot of times language is counterintuitive. You may actually mean, "No, don't worry, this will pass." But what that means to that person is it's going to be detrimental because, be strong, things like that. Or good for the person to hear. So I think it's important, like you said, to get sensitization. Shankar has a question which is in connection to what I asked. How do you respond when someone tries to open up but only want you to listen and not offer a solution? So a lot of times people don't really want a solution. They just want somebody who can listen. So this is Shankar's question, and I think it's an important question to address.
Yes. Shankar, this very good question, and also I think it's a problem that men uniquely have. All of us are inclined to jumping to solutions. I think there are two parts to this question. Right? When people want to open up, they want you to listen. They're not looking for solution in most cases, right? I think jumping to solution would also, lead to situation that you mentioned, Shreya. I think it's important to first practice active listening, creating that safe space that that person can come back to you again and again if they require somebody to talk to. I think is 80% of the solution. The second part is not offering the solution, but finding the right resource to support them. Whether to professionals or change in environment or finding a better avenue. There could be multiple things, but I think active listening is a large part of what we have to do.
There you go, active listening. Shankar, I hope that answered your question. Dilkash Sultana has a question. What if we express our mental situation, but people are not ready to understand it or ignore your situation? What do you do in such a scenario?
So this happens, I think, all the time, right? Because our tendency, conditioned by our own backgrounds, is to try to look for a solution, try to look for a cause. Let's say if I come to office and say, I'm feeling very irritated, the question that follows that is what happened, right? If I'm low, what happened? So I can offer you something that you can do. That the most easiest and most frequent response is you should go for a walk or exercise or yoga and things like that. Of course, they have a place in your life, but they are not the solution for everything. That's number one. Number two, in a workplace situation, there's also reading between the lines, right? People are trying to say, what is it that you want? Right? If you are saying this, is there something else behind it? Right? So there are many issues where people will feel misunderstood or not understood, or people might ignore situation. In our experience, what has happened is most of the time people stop engaging because, going back to Shankar's question and your question, is people don't know how to respond to mental health issues. For example, in the office, when you see somebody, let's say, carrying 20 kgs on their hand and struggling, immediately 10 people will come in to say, can I lend you a hand? But this invisible burden that you're carrying, there's no way you can even detect, or we don't know how to help this. So I think, again, going back to, we need to create that avenue for people to understand this.
Right. If you have any more questions, do post them in the Q&A box. We have Doctor with us for 5 more minutes at least for him to answer and respond. I think as we wait for the others to answer, question is now, if I want to be trained, if I want to go, is there an institution? Is there a certification? Because you know that first aid paramedics, there is a certified program which everybody is aware of, and you can become a first aid, certified person. But how do you do that for mental health? What is the access for you to do this?
Yeah, so there are 2 ways you can do this. One, which is a basic level, which is creating more awareness on listening skills. So we could have active listeners trained in the organizations. And then you could do a formal process, which is getting certified as a mental health first aider. And just like you have the physical health first aider, there's organizations which offer. And I believe Daniel is one of the leaders in that space. And there are many such organizations in India as well, which could help in creating that training and certification. And then I think the next part is to give that that group of people who are first aiders, mental health first aiders, visibility and recognition within the organization, right?
Yeah.
Because people have to know who can I turn to, and these people have to be seen as trusted, impartial, and knowing what they are supposed to do as part of the intervention.
Just like you have the prevention of sexual harassment committee, and you know who the convener is, and you know who to go to talk to. I think similarly, it's something that all organizations can do to invest in having mental health first aiders enabled and empowered to actually hit the ground running. Thank you so much, Doctor. The next question we have is from Suguna Jairaj, and she asks, how do we communicate this to our parents, because they always feel our generation is very fragile? I think this is an important question because a lot of millennials who are watching perhaps don't know how to talk about it. I know of cases where people who wanted to seek mental health, aid have been looked down on, frowned down on, and Ari's referred to it shortly when I was saying there have been people, why do you need counseling? Because somewhere there is this conflict of career counseling or directional counseling. I don't think there's enough awareness of even the kinds of counseling that are available. So tell us a little bit about how do you communicate this to parents?
Well, this could take forever because I think communicating to the older generation is going to be a challenge. Let's step back and see where this is coming from, right? The language we use, again, coming back to counseling. What was counseling to us when we were in school? Counseling was when you got in trouble, right? You went to the counselor when you needed to be fixed, right? There was no way you were going counseling because you want to be better. Coaching, however, is a much more positive word, right? People take to coaching as, okay, I'm an athlete, I want to do better, and hence I want to work with a coach. Counseling has got this negative connotation. So that's one part of the conditioning. The second is, I think also because of the generational gap, particularly in India, the previous generation went through so much struggle to get where they are, and they see the younger generation as having gotten most of it on a platter. So they say, we struggled through this is part of life, you just have to do it. But the younger generation realizes that this is not something that we can take it for granted. So this is sort of a generational gap. So how do we communicate this to your parents? I think it starts with, again, building that conversation, building that space, telling them that I'm not okay, right? No parent will come in and ignore that when a child comes to their parent and says, I'm not okay. But what happens is most of the time it doesn't come to that. It shows up as anger, it shows up as rebellion, it shows up as, the typical young people reaction, which elders then again take it as in a negative fashion, and then leads to this vicious circle. So I think we have to find that space, and that's why I'm a firm believer of, instead of doing it episodic, it has to become part of our dinner table conversations as much as it has to become part of our conference room table conversations.
Absolutely. Like you said, find out what you can do with your family at the dinner table and start these conversations. Malika Seth asks, what are the support coaching available to those who live with family members who are undergoing mental health issues? Now, a lot of times what we don't realize is even the caregivers need support. And this is true for even physical health ailments, which are long-term requiring caregivers that are sort of, completely involved in this. So if you can answer this question from Malika.
Yeah, I think that's a very important point. Lots of caregivers, lots of people who are caring for terminally ill family members require support. Caregiver support is a big area which I think we have not yet realized how important is it for many people. But coming specifically to mental health issues, there are two parts of this, right? One is people who are suffering or diagnosed with clinical mental health issues. The second is people who have been under treatment and have been, the condition is now exaggerated because of COVID. It's a very difficult challenge because now we have to start thinking about how do I get this support remotely. Fortunately, over the last 4-5 months, lots of therapists, doctors are online, so that's one way to engage it. But I think the most important thing for people who are living with family members undergoing mental health issues is to find them the right support. It's not easy. People are reluctant to admit. Families are reluctant to admit that they might need external help. So it takes a little bit of work. It takes a little bit of coaxing them to get to talk to somebody. And as a culture, we are not used to. I think, like Mukti and others mentioned, we are not used to going out of our family and talking to us. So what happens, and this is another area that we have to be careful, is not all mental health issues have to be treated by medicines. Right? Our first reaction is, let's take them to a psychiatrist. Yes, lots of things need psychiatrists, but there are also things that counselors can do, psychologists can do, psychotherapists can do. And in some cases, all of them have to work together. So let's not straight away jump to the extreme options available, because mental health is not just a medical issue, it's also a social issue. So we should not make it a medical issue in totality. So I think having that option to talk to multiple specialists who can find the right way to support your family member might be useful. Sorry, you're on mute, Shreya.
Sorry, Dr. Ashwin. The question to refer to, which was, how do you tell your family that you're suffering from mental health issue? There's a follow-up question on that. Even if you tell, you come across as a rebel, which is taken in a negative light. So how do you sort of navigate that, is the next question.
Right. So that is another issue which comes up. Like, parents are not able to understand. For example, we have had situations where parents have found out that their children are undergoing therapy or counseling with us, and they reach out to us asking why. Right? It's unimaginable, and they want to understand what's going to happen. At some point, I think you have to prioritize yourself and say, okay, I'm going to do this because this is important for me. There are other battles that I will fight in terms of convincing my family members to come and accept it. And hopefully, by seeing the change that I find by undergoing some professional help, will reflect on my behavior, and then they will see this as an opportunity. I think the thing to emphasize, the conversation to emphasize here is, everybody needs a coach or a counselor. Yeah. Even the best of the athletes in the world have a coach or a counselor. So what makes us different, right? For example, if you go to the gym every day, nobody's going to call you weak, right? But if I go to a therapist, why should I wait till I'm weak or something like that? So I think those kind of things, it will take time. Fortunately, COVID has accelerated some of these conversations in the workplace, in our community, etc. And hopefully this will lead to better conversations.
Absolutely. I remember reading this quote somewhere where it said, I go to therapy because the people around me that need therapy aren't going for it. So, so sometimes you're just dealing with really difficult scenarios, and perhaps everybody needs somebody to talk to who's neutral, who's devoid of judgment. Like a lot of times when I'm approached, I say, I'm not authorized in any form to handle this conversation because I'm also invested in you. I think what we should also recognize is when we want to help somebody, we need to know our level of investment in that person, because unless you come from a very neutral space, which is where a therapist will come from, and unless you sort of know how to navigate this, because we were having an earlier conversation where I said a therapist never tells you what to do. A therapist only walks you in the direction and path that you want to go on and lets you discover for yourself how to get through or get across what you're going through. So I think one last question before we wind up. If a person is ready to talk, but he's not opening up, how do we help them? How can we help him or her, through this whole scenario? That's the last question that I have.
Sorry, I think it's, given the limited information, it's very tough to say how to handle this kind of cases. But it is, let us understand that it's very difficult or a struggle for people to come out and talk about their mental health issues. And the challenge behind that is also biological, right? So if your body hurts, your body tells your mind that I am hurting. But if your mind hurts, how does it say? Who does it tell, right? So that's a big challenge. So most of the times what happens is when we have a mental health issue, it presents as something else. Yes. Sleeplessness, anger, body ache, and things which are not related to your health.
Yeah.
Exactly. So that becomes the way of it manifesting itself. But in this specific case of when somebody wants to talk but they don't know how to articulate, I think again going back, just create that psychological safe space that it's okay to talk. Again, going back to our campaign, baat karenge to hi baat banegi. Right? So that's how we have to approach this.
Right. You spoke about the connection, right? So functional medicine is gaining a lot of importance today because, like you said, what is manifesting as a symptom may actually be connected. And, right? Your mind and your body are so connected to each other that whatever you're going through is going to manifest in some form physically as well. And I think in a previous panel also, somebody alluded to the fact that they are connected. You spoke about how the mind and body are connected, and physically there is manifestation. So I think as time passes, I'm hoping and crossed fingers that all of these conversations happen a lot more and people can talk about functional medicine and mental health without it being a taboo. Thank you so much, Dr. Ashwin, for joining us here today and for walking us through this. Interestingly enough, this session also had the maximum number of questions coming in from the audience. And like you see, there is a need, there is a desire to know more, but a lot of people don't know where to go or where to turn. So I think that was a huge thank you note coming from the dive-in end to you for having joined us here today and for having taken us through all of these various points in context of mental health and what people can do. Really appreciate and applaud the work that you guys are doing, and congratulations, and hoping that everybody will be able to follow you now and tap into at least some of this information and knowledge that you have. Thank you once again for joining us.
Thank you, Shreya. My pleasure.